Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know, cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing.
Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa ating po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ko. May dugo na yung plema ko. Di pina-x-ray nila ako. Mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita mo, bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na ako nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank. Malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR. Pagbalik ko, salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mahigit ng 1 buwan, Maganda dahil yung dugo ng plema ko nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan-gaan na magaan-gaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po na yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom, nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na re-prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo.
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nag-iinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito na nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko, ang liig ko nawala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung parang naging resulta po, nung pag-combine po ninyo ng PPARS at saka po ng GPT po this past months po. Ano po yung mensahe na pwede nyo pong maibahagi sa kanila, sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayong mawala ng pag-asa. Ang cancer, nagagamot. May Simple Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang kaiinom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po, no, sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simple Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simple Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwedeng sa powder, ako po pwedeng sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, tapos very honest sila sa mga sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing.
Sheila, and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just to recap, last episode we discussed the immunotherapy in managing cancer. Lots of questions were asked and most especially answered by our expert last week. And this week, discover how cancer patients can benefit from using PPARS because tonight's interesting topic is entitled Cancer of the Prostate Prevention this 2024. Prostate cancer, though common, often lacks the awareness it deserves. So through this webinar, we'll delve into the latest advancements in detection, treatment options, and survivorship strategies. We extend our sincere gratitude to each and every one of you for tuning in into this webinar, and we encourage you to also share this online event with your friends and loved ones who will benefit from the insights shared here tonight. Without further ado, let's dive right in. Please note that there will be having what we call Ask Me Anything portion later on, so please feel free to drop your questions on the comment section. Leading our discussion tonight are distinguished health experts. To start off, I'd like to introduce a successful entrepreneur and a seasoned international speaker on a wide range of topics from personal success to healthcare, the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good evening, Sir Shyan.
Hi, good evening, Sheila, and good evening to all our viewers. Again, welcome to another episode of Simply Healed. I believe, Sheila, this is our 167th episode, something like that. So we've been going on for 3 years strong, day and night. Sorry, not day and night, rain or shine, all right, rain or shine. And then we've been doing this through all the holidays as well. So I don't think we've missed a single week, or maybe one or two in the last 3 years, right? So this started during the pandemic, where we provided this as an avenue where people could ask questions because we were all in lockdown, and we made it available so that people could ask questions without leaving their home. And we've continued it because of the strong support everyone has been giving us. We've always made every Thursday night very interesting for myself and Dr. Jansen, asking amazing questions, and we are exploring about health together. So without further ado, tonight we're going to talk about prostate cancer. It's something that's important to me because I'm 50 years old this year and I have to do my very first prostate exam. All right, so straight off the cuff, at 50 years old, all the guys, you have to do your first prostate examination, all right, to make sure that all is well. So we'll have a quick discussion with Dr. Jansen. And we'll have our Ask Me Anything segment, which will start around 7:50 p.m. And we'll answer questions for the next 30 to 45 minutes. Okay, so looking forward to that. I'll hand the time back to Sheila. I'll see you guys in a while.
Thank you, Sir Shyan. All right, and at this point, on to our next health expert. It is an honor to present our esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Please join me in welcoming Dr. Jansen Kalalan. Please watch this.
Hi everyone, welcome to another episode of Simply Healed, and with me today again is Dr. Jansen.
Hi Shyan, hello everyone. Welcome to another episode of Simply Healed again. So tonight, we're going to be discussing prostate cancer.
Yes, as part of our Men's Health Awareness Month. So prostate cancer. So Doc, we've talked about prostate cancer before.
Yeah.
So maybe something new is that we noticed is that prostate cancer is the third most frequent cause of cancer among males, and it's been increasing like 120% over the last few years. So more and more men are getting prostate cancer, and more prostate cancer patients are actually dying.
Yes.
All right.
Yes.
So that means the survival rate for prostate cancer actually seems to be dropping, despite most other cancers actually are improving. So why is this the case? And what's your advice for us? on how to protect ourselves from prostate cancer. And again, what's the prognosis? If you catch prostate cancer early, let's say stage 2, because stage 1 is really hard to discover, right? Let's say stage 2. What's the success rate?
For stage 2, it's still pretty high, at least 90%. Yeah, you're going to be able to live.
So don't allow prostate cancer to reach the 4th stage.
The 4th stage, yes.
All right, so let's go back to the original question. Doc, why is prostate cancer becoming more and more prevalent, and why is it getting more and more deadly?
A lot of factors, okay? So number 1 is the diet of males, of guys. So, you know, guys, we tend to eat more junk food.
He-Man only eat animal products.
Okay, so that's one of the reasons. Number 2, we don't usually go for checkups. We don't usually go for prostate checkups, blood works. Yeah, it's just the way it is. I think it's just the way men are wired. Okay. So of course, with less detection, eventually once you get diagnosed with you already have symptoms, you get diagnosed with prostate cancer. It's
already stage 3.
Yeah, it's going to be at an advanced stage already. Okay, so that's one of the reasons as well. And then mainly the diet. You know, the technology right now for treating prostate cancer is so advanced. No, prostate cancer is highly treatable. Okay, but you know, how come more men are dying each year? So those are one of the reasons, no? Okay.
So don't let it spread.
Yeah, don't let it spread.
The moment it spreads, the treatment is a lot more complicated, because it's now in your bones, in your liver.
Bones, yes.
Right.
Yeah. And more problematic there is prostate cancer tends to metastasize to the bones, and you know, once cancer metastasizes to the bones, it's going to be painful. Okay.
Wow, and you know, men cannot handle pain. Women can handle pain.
Our pain tolerance are lower. Okay, and also if your prostate cancer doesn't metastasize to the bones, your prostate might increase in size so huge, so large, you'll have difficulty in urinating, have urinating symptom. It decreases the quality of life. Quality of life is really so bad. Okay? Yeah.
So quick tip, because it's a topic we are familiar with, but let's a quick tip. How can we males make the greatest impact on preventing ourselves from getting prostate cancer?
Okay. Yeah.
What's the tip for that?
Okay, so we have to realize the risk factors for getting prostate cancer, and diet is the number 1 risk factor for this. No, okay. So what specific part of our diet is the one that giving us prostate cancer? It's dairy. Okay.
It's milk.
It's milk. Okay, dairy products. Your cheese, whey protein.
Whey protein.
Casein. Yeah, because whey is a derivative of milk.
Is that why maybe more men getting prostate cancer? Because a lot of us now are also health conscious.
Yeah.
Go to the gym.
Whey protein.
And we take a lot of whey protein.
Yeah, so
a lot.
Yeah, it's one of the reasons as well. Can be.
It could be. Maybe it is, because there are a lot of brands of whey protein today compared to 20 years ago.
Exactly.
Yeah.
Okay,
so the demand is there.
For milk, how much is significant? Okay, so here's the result of one study. So those consuming at least 2.5 servings of dairy products,
trying to wean off.
And if we translate this to glasses of milk per day, so those consuming more than 2 glasses of milk per day had 60% more prostate cancer than those who avoided milk.
Okay, this is crazy. 2 glasses of milk, and that's 60% more prostate cancer than those who don't drink milk. That is
that is a huge number.
Wow, wow.
That is a huge number.
That's a huge number. All right, that's a huge number.
Okay, so even 1 drink a day increases the risk by 10% already, and the risk is significantly increases. The risk significantly increases with each additional drink. Okay, as what I have mentioned a while ago. Okay, so why does milk increases your risk of prostate cancer? It's because milk increases the IGF-1 level. So what is IGF-1?
What is IGF-1?
Okay, so IGF-1 is insulin-like growth factor 1.
Okay. Oh, insulin-like growth factor 1. IGF-1.
Yeah, so this specific growth factor stimulates tumor growth. And this specific growth factor is very high where? in kids, in babies, because why? They need to grow fast. Okay,
Alright,
so a baby this size should have to grow as an adult size, right?
Yeah, three times within
size.
a year, right?
Yeah, within a few
Infant
years.
to
Okay?
1 year
So
old.
that's why they need this. Now, if you, as an adult, if you continue to drink milk or if you continue to consume dairy products, your IGF-1 level will increase. Okay, and if your IGF-1 level increase, your risk for cancer will also increase. Okay, so
Wow.
that is the link.
I mean, just as a sidetrack, you know, when men drink milk, right? Like when we take our whey protein, we are thinking to ourselves, I drink milk so that I will grow strong. But you know, have you ever considered? Have you seen a small calf? You know, a small cow. You know how a small cow grows into like a 200 kilogram cow in like 3 years, right? It takes us, a human being, look at your son, your daughter. How long did it take your daughter to grow from a toddler to a full-grown adult? It was 12 years, puberty,
Yeah,
right?
exactly.
But a cow, in 2 or 3 years, it will grow from like 20 kilograms to 200 kilograms. So then again, so that means you are drinking something that makes a cow grow from 20 kilograms to 200 kilograms.
Exactly.
When human beings take 12 years to grow from
Yeah.
12
And
12 kilograms to 60 kilograms,
You know,
right?
it's really funny because we are the only species that drinks the milk of another species.
That's right. And here's the funny thing, right? Cows don't drink milk. Only baby cows,
Baby cows.
drink milk.
Yeah.
Grown cows
Baby
don't
cows.
drink milk,
Yeah.
right? So I was just speaking to a friend of mine who's lactose intolerant, and she was popping the lactose pill.
Yeah.
And I said to her, actually, you know what? Do you know that you're the normal one?
Yes,
And we are
yes,
the
yes,
abnormal
yes.
one.
Asians are
We are supposed
innately
supposed to be
lactose
lactose intolerant.
Yeah.
Okay, yeah. Cancer is so natural to us now because what was natural has become unnatural, and what's unnatural has become natural.
Yes,
Right.
exactly.
Yeah. So, Doc, yeah, prostate cancer. Any last tips and information you want us to know?
So here's the good news, no? Even if you get diagnosed with prostate cancer, yes, it can be reversed. So how?
Wow.
Okay.
That's
So
good
here's
news.
a study by Dr. Dean Ornish. So Dr. Dean Ornish studied men with prostate cancer who were diagnosed at an early stage. Okay, so these men are actually on watchful waiting. So they are observing the growth large enough for them to undergo surgery or large enough for them to undergo treatment, radiation therapy or brachytherapy probably, you know. So they are watching they're in the observation stage. So while waiting, okay, they tried to change their diet, stress management, exercise, okay. They underwent this lifestyle program for 12 months, and lo and behold, this is the result of their PSA. Okay? Those who are on a standard American diet actually had their PSA increase. Okay? From this level to this level. Okay? And those who are on a plant-based diet actually decrease their PSA levels from this level to this level. Okay? So you can just imagine the discrepancy. Now, a PSA that decreases is a sign of cancer regression. Okay?
Not progression, regression, going backwards.
Okay, so going backwards is a sign of prostate cancer reversal. So, Doc, what if I have an advanced stage prostate cancer already? So, this research studied men with prostate cancer who already underwent radical prostatectomy. Now, if you are someone who underwent your prostate cancer already invaded the nearby structures, okay? So, that is one of the criteria. So, that is an advanced stage of prostate cancer, and once you undergo radical prostatectomy, yeah, they remove your prostate. So your PSA level should go to 0. Okay,
Because you no longer
because
have.
you don't have the prostate
prostate
already.
anymore.
All right. So the researchers studied these patients further. So now they compared their fiber intake, dietary fiber intake they compared their dietary intake with their PSA levels. So now, these patients who had a high dietary fiber intake actually decreased their level of PSA. Okay, so mind you, these patients already had recurrence. Okay, so if you have recurrence, what will happen? your PSA level will increase. Correct? Because there are prostate cancer cells that were left inside your body. Okay? So recurrence, prostate cancer, PSA level increased. Okay, so some patients underwent high fiber intake, some patients had a low fiber intake. Okay, so those patients who had a high fiber, it just goes to show, no, the diet, the food that we are eating has a big influence on whether, on the progression or the regression of cancer. Okay, so why is this the case? It's because of the antioxidants, the nutrition, the nutrients, the phytonutrients inside the food that we are eating, and we are actually eliminating those foods which promotes cancer growth, like milk, like dairy. Okay, so it's just basically, you know, allowing the body to heal itself and not putting more injury to the body. Okay?
You know, Doc, as you talk about this, and since we've been talking about lifestyle changes and in cancer for more than a year now, it just dawned upon me that, you know, lifestyle change is I'm looking at it that it's not so much sometimes that the vegetable that you eat is so good for you, because that's why we still need supplementation. I mean, that's why we still take supplements like Simply Nature PPARS or turmeric, right? Yeah, it's more, I think, like you stop putting nonsense into your body. It's like you can't exercise yourself. No matter how many sit-ups you do, you're never gonna get a six-pack.
Yeah.
What you have to do is you have to stop eating so much. That's the key to getting six-packs, to getting good muscle tone. There's no way you can pump enough iron, do enough bench presses that your muscles will bulge. At the end of the day, all muscle builders, all those bodybuilders, before they go for competition, they are on actually very strict low calorie diet, so that the muscles will show. So sometimes, you know, apart from the goodness of the vegetables, I think what is really effective is that you stop eating all these poisonous stuff in your body.
Exactly.
And that's why all these PSA levels drop. It may not be the goodness of the vegetables. It may be as simple as the absence of the toxicity of eating meat products, right? Yeah.
Okay, so yeah, that's basically it. Of course, if you are someone who is diagnosed with prostate cancer right now, very important that you change your diet immediately. Avoid eating the foods which are prohibited for you. Okay, then we can already begin taking Simply Nature PPARS as a immunotherapy. Okay, because our immune system again has a big influence on fighting cancer.
And especially one that's so slow like prostate.
Yeah, exactly.
You really have a good chance.
Yeah, you really have a good chance because
and since this is Men's Health Awareness Month, anything that you want to ask, be it performance issues, right? That's linked to metabolic syndromes like diabetes.
Exactly.
All right, and we can help with answer those questions as well. All right, so without further ado, let's go to your questions.
There you go. I'm very sure the questions coming in and thrown to us privately by our viewers as well. And now, to answer our questions in this modern world filled with noise and different health opinions, trust the ones from the experts. Let's call on once again to answer our questions, Mr. Shyan Lim. Hi, Sir Shyan.
Hi, Sheila. And guys, Doc Jansen, during this season is actually going for TCM program. So he's going to come back to us as traditional Chinese medicine under his belt as well. So he'll be joining us. Actually, his lessons are, he's actually taking his lessons tonight. So it's ending. I think he'll join.
Thank you, Sir Shyan. First off, our question is coming from Mr. Romeo Mariano. I don't want to undergo radiotherapy treatment. Is there any alternative?
Okay, if you don't want to undergo radiation treatment, right? So you can always try treatments like Simply Nature PPARS. Okay, so for our audience, I will call my answers will focus around PPARS because that's my area of expertise. Dr. Jansen will give you the other possible protocols that you can take. But of course, on my side, I can also give you advice on what generally accepted other modalities, okay? But anyway, when it comes to PPARS, can be a benign growth. So that our PPAR protocol also helps benign growth. Now, it also modulates inflammation. So there are a few options when it comes to a cancer tumor, right? You have number one, to operate. Sometimes a cancer tumor actually fuses to the bone too. And of course, when your cancer has spread, when there's metastasis, you can't operate on metastasized cancer tumors, right? Because usually they spread to multiple areas, and there's no point only removing one place. So if your cancer, so it's more than one place, there's no point just already in the lungs, unless you can operate everywhere, but that is where it's not possible. So the other protocols, standard protocols, include the recovery as well as the effect of the protocols. Now, if you want totally natural, you can choose to use Simply Nature PPARS protocols as one way to manage your cancer tumor growth, all right, or to even shrink it. However, I always caution anyone with cancer, when you use any protocol, you have to be ready to schedule your diagnostics. So, for example, you got to talk to your onco or speak to Dr. Jansen. If you don't want to go and see an onco, speak to Dr. Jansen. There are standard times when you go for your scans. Protocol is working, okay? So your cancer is working, but it may not be enough, all right? So there is a few things that will happen when you go for a scan. You might, if people are line, there should be a red line, right? If you use a particular natural treatment, be it vitamin C drip, Simply Nature PPAR protocols, a combination of acupuncture or Chinese herbs, or a combination of many alternative approaches to managing cancer, there should be a red line. You should reach a point where you know, okay, the cancer is still growing aggressively, I've got to use other protocols.
I hope I didn't miss a lot of things.
No, we're so glad. We just started the first question. So welcome. Doc, I just wanted to ask you, even before we start class, how's your classes going?
We're starting on the basic concepts of PCM. So
It's interesting, right?
it's interesting. We first tackled the yin and yang, the concept.
You realize the way it's like quantum mechanics, you know, the balance, the yin and yang happens at multiple levels. So it's like you can level, and it's still the same mechanism, right? It's like your positive, negative charge. Always, so it's a reflection of that. So I'm glad you are enjoying it, and it is our cultural heritage as well. So, so it's going to be interesting. So again, guys, July 27th, we're going to have a live SMX, right? So
Dr. Jansen, we truly miss you. It's true. Okay, so for the next question coming from Miss Chris, is prostate cancer less dangerous than other types of cancers because it grows more slowly than the other types?
Yes, correct. If you just go on Google, do your own research and try to compare the survival. Because if you just try to compare, prostate cancer and pancreatic cancer, the difference in survival rate is so big.
No, I believe even for stage 1 prostate cancer. Yeah. And I want to just share good news. To anyone who has a love, if I'm not wrong, it was stage 3, stage 4 prostate cancer. So he's just been on soft gel capsules. He went for some sessions of chemotherapy. And then after that, his nephrologist said it was okay because his PSA levels were under control. So he's now actually in his mid-80s, all right? So there's a wonderful example of, and I hope it's encouraging to any prostate cancer patients out there.
Thank you, sir. It is actually very encouraging. Okay, well, for the next question, thrown to us privately, this is the question is prostate cancer stage 4. What are the chances of survival? And you just mentioned.
Okay. I'm going to just mention the 5-year survival rate of stage 4 prostate cancer, which is 36%. But this number, how should we interpret this? It's basically when we're talking about survival rates, statistics, it means that after 5 years, no, patients who are diagnosed with stage 4 prostate cancer, after 5 years, 36 out of 100 of them would still be alive. Okay? So it's a statistics, right? These numbers should not be individualized because the situation of patients are unique. Okay, our genetics are unique. Okay, our situations are also unique. The treatments that we've underwent are unique. Our lifestyle are also unique. Okay, so these numbers should not be individualized. Okay, and these numbers only represent the population wherein we see similar cases. Okay.
Would you like to add anything, Sir Sean? Or
No.
proceed?
I'm good. I'm so glad Dr. Jansen's here. We're just gonna let him answer all the questions.
Okay.
Sure. All right, so for the next question, coming from Mr. Manuel Go, what foods and fruits to take that is good to prevent prostate enlargement?
Ah,
not just prostate.
yeah, the diet, there are actually a number of diets wherein we see reduced risk of cancer overall, no? Not just prostate cancer. So that would be, so if you are a total vegetarian, that's one. And another one is the Mediterranean diet. It also does almost the same risk reduction in risk. Yeah. So those two are the diets that you can consider following.
Okay. All right. Okay, coming from Miss Lilibet Palma. Okay. What are the age or what age do prostate cancer usually occur? And what are the common symptoms?
Okay. Prostate cancer, when we look at the population, the different age groups, we see a uptick in cases at age 50 and up. 50 and up. That's why we screen for prostate cancer at age 50. Okay. Yeah. We rarely see prostate cancer at ages less than 50, but we do see them. I actually saw one. Yeah. Prostate cancer patient. He is at how old was he? 46, I think 46 or 48 years old. Yeah. And what was the second question? The symptoms, no? Some common symptoms of prostate cancer. You can feel frequency. You can have dribbling. Dribbling is when you urinate, right? There is some. Okay. Normally, when you urinate and when you empty your bladder, there should not be anything. There should not be any trickles left. Okay. Everything should be expelled. Okay. Urinated. When you have dribbling, you cannot urinate. You cannot empty your bladder, and there is some drops left at the end. So that's dribbling. Another one is intermittency. Intermittency is when you normally when you urinate is a straight stream, right? When it comes to intermittency, that stream is intermittent. Yeah. It flows, then stops. It flows again, then stops. It flows again, then it stops. Yeah. So that's intermittency. Another one is when you have to strain when you urinate. Yeah. And of course, nocturia. Nocturia is when you wake up multiple times at night, no, to urinate. Okay, those are some signs. However, these signs, no, can also be signs of a plain benign prostate enlargement. Okay, so you have to be careful. Don't When you feel these symptoms, don't panic. Okay, it just tells you that you have to go see your doctor. Okay, don't catastrophize that you have prostate cancer already. Yeah, because this can affect your mental health, of course. No, so try to. I know it's easier said than done, but try to do some self talk. Try to convince yourself to relax. Everything is gonna be okay. What I have to do is go see my doctor. Okay, to have some workup done to know what exactly is I am facing. Okay, so that's the proper it's gonna be the end of the world and all these things. Okay, so relax, guys, relax.
Absolutely.
Doc, just a follow-up question. Since
Mhm.
the common symptoms has something to do with you, we are also prone to having UTI or urinary tract
Ah,
infection.
no, no, no. It's different
Mhm.
for men. UTI in men is very uncommon. And usually when we do get urinary tract infection, there's something, either there is a
Try to,
genetic abnormality
uh,
or there is something blocking the outflow of the urine, or we really got infected through sexual means, sexual activities. And, yeah, so
Right.
these things,
Well, it's
yeah.
good news for guys. Okay. All right. Well, for next question coming from Miss Lilibet, Doc, does prostate enlargement can lead to prostate cancer?
Not all the time. Prostate enlargement can mean that you have a benign prostatic hyperplasia, or there is really a malignant entity that is growing inside your prostate. So, so that's why simple prostate enlargement has to be further investigated. What is the reason why the patient has the prostate enlargement in the first place?
Okay. Thank you, Doc. Okay. First question coming from Miss Jen Chang-Ang. Hello, Doc. Hello, Doc. Can PPARS tablets slow down the progression of neurodegenerative diseases? Thank you.
actually, this is
Interesting.
a interesting question because this is something close to my heart too, Doc. Because in Singapore, the diseases, the brain disorders that are, I guess, worrisome for most families is past 70 years old, right? So Alzheimer's, Parkinson's, ALS, Huntington's disease, multiple sclerosis, all these are actually things that we're worried about. So I will start with PPAR, just PPAR agonists in general, right? So PPAR agonists in general, the antioxidant effect, the regulation of lipid metabolism is a feature of some of these neurodegenerative diseases. So if you can normalize your lipid levels, this is beneficial. All right. Then next is anti-inflammatory. So for most brain disorders, not only the neurodegenerative diseases, but even actual other brain disorders like schizophrenia, depression, and yeah, neural inflammation is one of them. So having anything that is able to manage chronic inflammation is going to help you, protect you from developing in the sense that it makes the condition less favorable for it to happen. And last but not least, PPAR agonists have been may protect neurons from apoptosis and other forms of cell articles that show that PPAR agonists can be used to minimize neural damage when you have a stroke. But that is only if it's taken quickly. All right, it can actually minimize the damage and it can help with the recovery. But if you're talking about minimizing the damage, if it's taken very quickly, like within a few hours of an actual stroke, it can actually minimize neural pathway damage. I've seen some research on that, and most importantly, I have a client who actually recovered from a very debilitating stroke just by taking liquid PPARs. And of course, he had a very strong will to want to be able to walk again. So he was actually half paralyzed. Doc, what about yourself? From the mechanism of action and maybe from your own experience, this is a very interesting question because it's not what we originally use PPAR tablets for, right? Brain disorders.
Yeah. I have to be honest, I have very few experience when it comes to neurodegenerative diseases because 95% of my patients are cancer. So
Yeah,
this is
that's why you are
I'm
an
going
expert on cancer. Yeah.
yeah, so I'm gonna be coming totally from a theoretical point of
Theoretical.
view. Yeah,
Mm.
theoretical, no? Um Yes, no, the answer is yes. It can help slow down the progression. You know why? It's because of the EPA and DHA that is innate in the PPAR tablets. That's one. Another one is the detoxification property of the PPAR tablet. So PPARS is microalgae. It's made from microalgae. No, so with microalgae, you have two main um, species that we that humans are consuming. So you have chlorella and spirulina. PPARS is made from a unique strain of chlorella that is growing in Taiwan, no? And with the chlorella family, one very good property that they have is it pulls heavy metals very effectively from the body. Yeah. And one of the heavy metals that is very, I wouldn't say influential, but one of the more problematic heavy metals is mercury. Yeah. Seafood. Okay. What else? In the air that we're breathing here in the city, especially those living in the metro. Yeah. So that you think about it, it's really quite surprising, no? Mercury is such a heavy molecule, but it is present in the air that we're breathing.
Yeah.
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 You,
Very
you
disconcerting,
know,
actually.
yeah, you know how I knew how I can make this claim. It was a few decades back when we were still in undergraduate school. So I studied in DLSU. So my undergraduate degree was physics. One of my classmates, his thesis was to analyze the air. Um, yeah, analyze air samples basically. So
In Metro Manila?
in Metro Manila, yeah, in Metro Manila. So, I
Oh
wouldn't,
my God.
but that is the it's not the main it's not the main thing that they wanted to do experiment on in his thesis. It was a different thing, no. I will not mention, but
Okay.
this was just an interesting um thing that they did out of curiosity. Okay, so they measured the air and they looked at the spectrometry. Yeah, the spectrometry is a measure wherein if it spikes, no, that specific element is present in the sample. And mercury was there. So we were all surprised actually, even my
Um,
professors. This person actually got one of the best thesis awards before when we were
wow.
students. Are present inside our body. That is for sure, especially if you're living in the city. So it is a good idea to detox with paper tablets because yeah, it can really pull out heavy metals really effectively. And with this, no, it can definitely slow down the progression of neurodegenerative diseases like your Parkinson's, your Alzheimer's. Um, I forgot the name of the disease. Muramata. I think it's Muramata's disease, no? That is mercury toxicity in the brain. Dementia as well. So these are all linked to mercury toxicity. Okay? So there you have it.
Yeah, I think Doc, it's quite scary, right? That yeah, because every time like when I go back to Singapore and I come back, maybe I travel very often, so the thing is not so evident to me. But like when I was last in Singapore with a guest, our bishop from our church, he actually noticed like his sinuses were gone, and yeah, and lots of his lungs, he could breathe easier. So the Metro Manila air is actually different. And when I went to Japan and I came back, I could actually feel a difference also. There is a heaviness in our air over here. So the pollution here is actually very significant. But most of us are so used to it already. Yeah, so used to it. So I think it's really great that you are taking, that we can take something, and this one is specific, as Dr. Johnson shared, with algae. Algae are used, believe it or not, algae are used in industrial complexes to pull heavy metals out. So in some industrial complexes, for example, your chimney, they have to have very tall chimneys because you're supposed with algae. Because algae are metal scrubbers, it will actually scrub remove heavy metals and metals from the smoke before they release it into the air. So imagine it'll be something really good. It's like dietary fiber, right? If you take a little every day, so you do a little bit of scrubbing every day, right? So I think that's just something that is a great maintenance, a great part. You know, Doc, just before joining this program, I was listening to a financial podcast. It's called I forgot the name, the Coconut Financial Podcast. Yeah, and it's a cute name. But today they were the two people on there was two doctors on a financial podcast, two doctors. And they were talking about financial planning because in Singapore now, many people don't need to buy don't need to buy life insurance because life insurance is for your kids. You know, it's not for yourself actually. It's when you die, you are worth more dead than alive lang. Okay, when you die, your kids become millionaires, right? So here's the funny thing about today. Today, many people live very long, and by the time they die, their kids are actually all grown up and have their own careers already. So many people realize that they don't have to buy life insurance or the term insurance. They don't have to renew it as they grow older because they don't need to take care of their kids. Their kids are already self-sufficient. So what's happening is people are getting this idea that since I can save a few $1,000s of my premium from insurance every year now, because I have properties that I'm going to leave to my kids, I have some savings, I have stock portfolios that I'm leaving to my kids. I don't need another insurance payout to leave to my kids. So they're moving what they're paying for their premium every year and moving into healthcare, getting a physical trainer, supplements. So they're moving their budget from financial protection to actually immediate investment into their health. So I think this is really an important thing. So I think for everybody, this notion that we should invest in our health, lifestyle medicine, in supplementation, this is actually going to be more and more so. Yeah. So that's a good question that was asked. Yeah.
Thank you, Sir Sean. Thank you, Doc Jansen. Okay. So for the next question, coming from Mr. Lito Carillo. Good evening. I have prostate enlargement. What would be the best protocol or medication? I've been taking the medication for 2 years now, but nothing has changed. I hope you can help me. Thanks and God bless.
Oh, very good.
This
Go for a
patient would
consult.
have to consult. Yes, I need to know the name of the medication. Then I have to assess the risk factors as well. So yeah, but from my experience, no, I've actually seen a lot of patients who has a prostate enlargement. But most of them, we've had some degree of success when it comes to shrinking down some hope, no? There's some hope. We can definitely help you.
Yep. Good hope that you're gonna be able to shrink down your enlarged prostate.
Right.
So you came to the right show today, face to face as well. Just let them know.
That's correct. Just type in how to consult. We'll get in touch with you immediately. All right. Okay. Another question. Since we are in the topic of consultation, another patient is asking, do you also accept patients with advanced lung atelectasis?
We have to work hand in hand with your other doctors. But definitely, I can see you and get an assessment.
Because there's always things that you can do outside of medication that you want to do in tandem with whatever your hospitals or the specialist is treating you with.
Exactly. Thank you, Sir San. Thank you, Dr. Jansen. Another question coming from Ms. Minda Banella. Can I take Ensure milk plant-based as part of my diet while I am taking PPARS?
It's okay. It's definitely okay. But here's the thing, no. I usually advise patients when they're taking PPAR tablets or anything microalgae, no, for that matter, it should be taken on an empty stomach. Okay, empty stomach. So don't take them one after another or just very close together. No, usually it's 1 hour before you eat or 2 hours after you eat. Okay, you know why? Why? Again,
yeah, please share with us why, Doc.
We have microalgae are very good in holding things, in pulling out things, no? So if you mix PPAR tablets together with food, it's gonna hold the food. It's not gonna be pulling out the heavy metals from your body. Okay, so are things that we have to weigh out. That's why I advise. But for all of you, no, don't take your PPARs together with food. Okay, it should be again 1 hour before you eat or 2 hours after.
And so you can see the side effect is weight loss. Huh? The side effect is weight loss. Prep cycle. You burn more efficiently, increase your metabolic rate in general as well. So that helps you burn. Yeah. So, but as Doc said, take it 1 hour before. Right.
Very good. 1 hour before, guys. Okay. All right. I guess let's just answer maybe 2 more questions coming from our audience.
I'm actually curious myself.
But it is true, guys, that actually a healthy sex life is healthy for you. But nothing in excessive, right? Nothing in excessive. Actually, since Doc is giving a check, it's very interesting in TCM. It's not good to be very happy all the time. It actually causes you to be imbalanced. So it's good to be happy, but not overly happy. Because even overly happy causes your body to be out of balance, and it can actually create illnesses. All right, so that's quite interesting, right?
Yeah, I found an answer. Can I share my screen?
Yeah.
I
Julie?
can, right? I can.
Yeah, try.
This is really interesting. It's really interesting, and I want to share it
Yeah,
with all of
Junie,
you and
can we
read this together.
can Doc share screen? Who's the host?
It's Mr. Juni.
Yeah.
Okay. I can already.
Okay. Oh, I'm
Okay.
very
So
curious what Doc is gonna
here
share.
we have it. So what I look for is frequency of sexual activity and prostate cancer risk. Okay. And this is what Google told me. Okay, before we go to the AI, to the artificial intelligence result, no. This article from Harvard Health, no. Men who average 4 to 6 ejaculations a week were 36% likely to be diagnosed with prostate cancer before the age of 70, compared to men who ejaculated less than 2.3 times a week on average. So it means that
Yes.
it can
Yes. Sex reduces your risk of prostate cancer.
yes. If everyone, for the men out there who are watching, if you want to read more, just go to this link, search for this article, okay, and read. Okay. Then let's take a look at the
AI.
Harvard TH Chan School of Public Health also found that yes, reduce prostate cancer risk, ejaculating more than 20 times per month.
Oh, that means more than once. It's almost once a day, right? Yeah. So I think I noticed it's not only not only a reason for men, because I noticed in Philippines, many wives make demands on their husbands also. So now the wives can say, "Dear, I'm doing it for your health, for your prostate health."
Yeah, and this is the AI search result, no. So the way Gemini, that's Google's AI. The way Gemini shows its search result is it gets articles from different. It gets information from different sources. So these are the sources that it got its information from. So that's the first thing that you have to look for, no, when you're using AI. Look at the references, and the references that they cut are these are just a summary. 2016 Harvard Health study found that men who ejaculated 21 or more times per month, 31% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times.
Very significant. 1/3, 30% is actually very significant. Okay.
But it's also ejaculating 3 times as much per month.
All right.
Yeah, so another study, 2004, JAMA study, ejaculation frequency, unrelated to prostate cancer risk, but high frequency was associated with a decreased risk, no? So I don't know what that means, but anyway, another one, moderate frequent ejaculation was associated with a decreased risk of prostate cancer. So,
Wow. So
in
there is
conclusion,
very
yeah,
yes,
it
yes,
can,
it is.
it can, it does.
It's an interesting question that our viewer asked, right?
Go, guys. Okay.
It's okay. If we are thinking of breast cancer metastasizing to the thyroid, that is very, very rare. Very rare. It's very, very rare. Okay. Although it can happen theoretically, but it's going to be very rare. So if you are someone who doesn't have breast cancer anyway, the breast nodule and the breast lump are not related, but it can be a symptom of the same problem. What do I mean by this? Hormonal imbalances actually, or excessive hormones can manifest such. Genetics can also, it's not related at all, but it can come from, okay, so these are different branches. Okay, so imagine a tree. So one branch is thyroid nodule, another branch is breast lump. It can come from the same root. Okay, so if you know what I mean, so it can come from it can come from the same problem. Okay, so yeah, to help you more, you have to go for a consult.
If you wish to have a consult with Doc Jansen, the link for you to schedule a consult is in the description box in the comment section, or you can just type in how to consult and we'll get in touch with you right away. All right, I think this will be our last question for tonight, coming from Miss Marjorie. Can diet reverse prostate enlargement?
Diet alone, yes. Diet alone, yes. Yes, there are a lot of studies showing that it has done so. Yeah, plant-based diet.
Any food in particular specifically for
Food for just a plain benign prostate enlargement. So we're talking about here non-cancers, benign
Non-cancer.
ones, no benign ones. Foods that are very high in antioxidants, so that would be your berries, green leafy vegetables, food that are plant foods that are very how should I say, the color of the plant food is very strong. No, it's not the proper term. Matingkad, that in Tagalog, matingkad.
it is
What's
strong.
English?
Yeah, strong is
Matingkad.
strong is
Strong,
correct.
is it the right term?
Yeah.
Is it the right term? Yeah. So I'll give you an example. Apples, no? Apples have different redness to it. So there are apples wherein it's pinkish. There are apples where it's really red. So go for the redder ones, no? So that's what I mean. Another example is dragon fruit. Dragon fruit has purple ones and white ones, no?
Yeah,
The pale
yeah.
ones. Yeah, so go
Which
for
one
the
is
purple
better?
ones.
Okay.
Yeah. Okay, so that's what I mean by foods that you have to go for, when it comes to shrinking prostate enlargement, because prostate enlargement is usually linked to inflammation. Yeah, so just consume lots of antioxidants. Yeah.
And I just want to add, since Dr. Johnson talked about colors, there is actually a simple, it's not like super scientific, but it's more like an easy rule of thumb. You want to have 5 colors in every meal, have red, white, green, orange, yellow. So that's why salads have always been been easily considered to be very healthy, because we have a mix of vegetables. But one thing of interest to note is that vegetables that are purple in color are usually, rule of thumb, good for healing, right? So that's an interesting. I forgot what the other colors are good for, but what struck me when I read this rule of thumb thing is that purple was good for healing. So that would be your brinjal, right? Eggplants, yeah, and so on and so forth. Just something as a simple, fun rule of thumb thing.
Very helpful, actually. Thank you, Sir Sean. Thank you, Doc Jansen, for that wonderful tip. Well, just before we say goodbye to our viewers, and also as you know, our viewers are a combination of those who are in prevention, of course, who are already in the journey of prostate cancer, and who are preventing the relapse or recurrence. Okay, I'd like to ask for quick parting words from each of you. Would like to start?
I'll go first because we missed
Okay.
Dr. Jansen, so let him have the last word today. Guys, it's always fun to have our program. Tonight is a bit male oriented because it's prostate cancer, but we're here every Thursday for you, so look forward to seeing everybody next Thursday. We're gonna always cover cancer topics, and it's so interesting. There are lots of development in the entire healthcare industry right now. Very exciting, actually. And also a lot of different approaches to treatment now. Look at Doc Jansen. Not only does he have integrative Western medicine, now he's adding TCM. Who knows? In 5 years, he'll do Ayurvedic medicine as well. The Indian medicine, right? So it's really interesting. The world is, the options are opening up. People are really truly exploring and also accepting and understanding new approaches to treating cancer and how we can better win that journey. So we're here with you from start to healing, and we are even committed to going to school so that we can be here with you. So we'll see you next week.
Yeah. Topic tonight was all about prostate cancer. Prostate cancer, no, again, it's a cancer that has a very high survival rate, and usually patients who develop prostate cancer, they don't really die from the prostate. Even don't what's the proper term here again? Don't ipasawalang bahala. That's the Tagalog eh.
Complacent or be lax.
Don't be complacent. Yes, don't be complacent on it. No, if you have a diagnosis, still please go see your doctor. Okay, because we cannot just watch and wait. Although it's a really a recommendation that you can find in the medical guidelines. No, there is always something that we can do proactively. Okay, especially when you have the means. No, let's do something. No,
Yes.
because although it might, no, the things that we can do might not shrink the cancer per se. It can make you healthier, fix the things, your risk factors why you had the prostate cancer itself, no? By just fixing the risk factor, when it comes to prostate cancer, okay, by just fixing the risk factors,